Good afternoon, and welcome to our presentation entitled Identifying and Reporting Child Abuse and Neglect. I am Dr. Dion Coker-Apia, child and adolescent psychologist and associate professor in the Department of Psychiatry at Georgetown University and MedStar Georgetown University Hospital. And I am joined by my colleague, Michael Rivares, and he will introduce himself.
Hi there, I'm Michael Rivera. I'm a licensed clinical social worker and assistant professor in the Department of Pediatrics here at Georgetown University.
Thanks, Michael. Okay. So today we will be covering a brief introduction of mandatory reporting, the associated requirements. We'll touch briefly on the importance in military families to start, and then we'll delve more into that later in the presentation. And then we'll focus on specific aspects of reporting, the who, the what, the consequences, and then we'll wrap up our presentation by focusing on the military context with some additional guidance. We'll provide some resources and some references, and you all will have access to our PowerPoint presentation with all of the resources and references. So to begin with some definitions of mandatory reporting refers to the legal requirement for certain individuals to report known or suspected cases of child abuse, neglect, domestic violence, or other forms of harm. And why is this important? It's important because it's really important for us to ensure the safety and well-being of individuals, particularly those who are a part of vulnerable populations like children, spouses, and dependents in military families. The requirements. The code mandates that anyone who suspects, and you don't have to prove that any type of abuse is happening. You just need to suspect that it happens or that it is happening. So anyone who suspects child abuse or neglect must report it immediately. And the reports can be made to any local or state law enforcement agency or the Department of Family and Protective Services. And it warrants mention here to just briefly discuss the Tarasoff rule, which is the duty to warn or protect. And this rule was established for mental health professionals to ensure that they understand that they have a duty to protect individuals who are being threatened with bodily harm by a patient. And the original rule occurred in 1974, and that rule established a duty to warn. 2 years later, in 1976, there was a rehearing of the case by the California Supreme Court where they determined that we needed to extend that beyond just a duty to warn. So now mental health professionals actually have a duty to protect. And why is this important in military families? 2 reasons. One, there are unique challenges that military families face, and those stressors really exacerbate issues like child abuse. And they could be things like frequent relocations, deployments, and separation. And then the most important thing here is that the goal is to protect these vulnerable individuals. And mandatory reporting helps us to do that. And it helps us to also intervene in situations where abuse or neglect is occurring. And we're also able to provide support and protection for those in need. Now, who has to report? And I'll split this up into the civilian side and the military side. So in Virginia specifically, from the perspective of the civilian reporters, we're talking about healthcare providers, teachers, social workers, law enforcement officers, child care providers, mental health professionals, and clergy members. Now, when we're talking about the military side of this, we're talking about all members of the military community to include active duty personnel, reservists, officers, enlisted personnel, and civilian employees of the Department of Defense. They're all required and mandated to report child abuse and neglect within the military context. And what has to be reported? Suspected or known instances of child abuse and neglect. And that can involve military dependents or children under military jurisdiction. And just to be a bit more specific, we're talking about physical abuse, sexual abuse, emotional abuse, neglect, and any other form of harm or exploitation. And with regard to the reporting process, the procedures vary based on branch and location, but the overall rule, or generally speaking, We're talking about notifying appropriate authorities such as military law enforcement, military police, family advocacy programs, and child protective services. Now, what are the consequences? Pursuant to the Virginia Code, which has provisions for child protective services and adult protective services, and in this presentation is specifically focused on children or youth, a mandated reporter's failure to report as soon as possible, or at least within a 24-hour period, can result in a fine. And when we're talking about military, failure to report suspected cases can result in disciplinary action. And just to give an example of some of those types of actions, we're talking about administrative actions, non judicial punishment, such as Article 15s, and then court martial proceedings. And all of this is guided by the Uniform Code of Military Justice, or UCMJ. And now we will transition to dive a little bit more deeply into the military context as it relates to mandatory reporting. So I hand this over to Michael. Michael?
Thank you, Dion. Thank you for painting a wonderful picture of the mandatory reporting process. And I will now dig a little bit deeper into the different parts of the military side of what it means to make a report and how we can better support our families. Unrestricted reports, those are the reports that we make. They are the reports that, as licensed professionals, we're obligated by our licensing board and disciplines to make a report based on the suspicion or the actual concern about child abuse or maltreatment, as Dion laid out earlier. Unrestricted reporting, when considered in the military community, also allows the victims to receive medical treatment. It provides them with advocacy and then all the legal support that is provided by the military service. And they are also eligible to receive an expedited transfer if that is something that is required in this particular case. Um, there's also the sexual assault programs that all installations have, and they are eligible for that as a victim of an unrestricted report. Now, if we think about restricted reporting, that is something that you may be asked by a military family, and there can be a little confusion about restricted versus unrestricted. Well, in short, since we are unrestricted and we make all the reports that are required by our license, when you consider a restricted report, what they are asking for is that this is something that is handled more internally by the division of which the military family service member is a part of. And so, an example of a restricted report would be if two adults had a domestic violence situation, the MPs were called, and after his command was notified or her command, they would do a restricted report to keep it in house, and it may appear on the service member's file as a communication class or a parenting class, but the work that would be done by the military is to assist that couple with therapy or education, psychoeducation, not necessarily therapy, to be clear. So restricted reports are reports that, as a civilian provider, you do not have to worry about or do, because you will follow your license and your discipline guidelines when reporting. One of the things that you often see when working with military is the use of acronyms. And I am probably as guilty as other people of sometimes slipping in an acronym and not spelling it out. And so one of the things that we'd like to do to help is that we have an online library that is full of all of the acronyms, and we always welcome more acronyms if you see one that's not listed. One that is really important when we talk about children is the acronym of the SLO, or the School Liaison Officer, which is a very critical part of working with families where children are involved, and school is a part of the what we're discussing. Next slide, as well as physical health. So here's the deal: dual reporting. There is no dual reporting. You are obligated to make the report to your reporting agency. And again, I will say that ad nauseum, to the agency that is required by your discipline or your license. When that happens, the agency that receives the call will have a relationship with Child Protective Services in the local community, and that will be forwarded. And so I'd like to go to the next slide to talk a little bit more about what that looks like. And so, I'm sorry, can I do this over? Really? Can I have one more shot at just the whole thing? I don't know. I know. Okay. Okay. All right. All right. Okay. Okay. All right. So the one before. Okay. So dual reporting. We are not dual reporters. As I mentioned earlier, we are required by our licenses, by our disciplines, to make a report on the civilian side of reporting. And so that means calling Child Protective Services. One of the things that is really important, and this is where when I work with new social workers and supervision, I often talk about the importance of how we make the report and being able to shepherd the family through a process where, if you're going to make that report, encourage them to be on the call with you so that the receiving end has a degree of a warm handoff. I have this family. This is the issue that I'm concerned about. The parent is on the line. They will take that. They will then advise them about their responsibilities of connecting with the military installation, that is, the installation of the person who is the adult in that case. But the short is there's no dual reporting. But the art of it is that we really want to make sure that we're working on alliances with our families and strengthening those alliances. Next slide, please. The the military branch related considerations are simply this: everything goes back to readiness for duty and fit for duty. And so, whenever we're working with a family or the military is considering that something is going on with a family, they're going to ask the one question in that at the end of everything is, how does this impact service readiness? And so, to make sure that our men and women are mission ready, there are a couple of things that the military has now instituted to really help families. One is compassion assignments. If a child has special needs, a military member can alert their command, and a compassion assignment may be something that is considered. Now, it's important to also understand that many people are concerned about how that may impact their career. So it's something that is not taken lightly, but it's something that the military is definitely dedicated to doing. To doing. The other thing is transition age youth and the implications. So many of our military members are so young that when we think about our role or our definition of pediatrics, they are still in that catchment area. They are under the ages of 24, 25. They are still adolescents to a large degree. So, cognitively, there are a lot of issues that they will share with children who are actually in families of military families. And then one thing that is always a good resource is the Exceptional Family Member Program, or EFMP program. You will hear that acronym a lot, and it is one that, if you can have a relationship with someone who is in that office, it is nothing but a blessing to the family to be able to say, I know someone in this office that I can do a warm handoff to. Next slide.
Thank you, Michael, for a great overview of the nuances of mandatory reporting, specifically as it relates to military families. I know it can get a little confusing at times, so I really appreciate you teasing that out for us. I'm going to continue with talking a little bit about a screening resource that is available for providers who are dealing with families who may be experiencing some type of trauma. And for those of you who were present with us a couple weeks ago during our didactic, we talked about this resource. I'm going to mention it again today. And the Child Traumatic Stress Care Process Model is a model that providers can use to assess trauma among youth. And there are two processes, one for those ages 0 to 5 and another for those ages 6 to 18. And they both involve a type of questionnaire or screening tool to help assess trauma, as well as a roadmap that providers can use to inform care. So, this is a great resource for providers, and you'll have access to all of this information when you're able to download the presentation. And then the next thing that we want to share is just some resources. We mentioned a lot of programs and resources in this presentation. So the resources here are for the Family Advocacy Program, Military One Source, the National Child Abuse Hotline, Child Welfare Information Gateway, and then Military Family Support Centers, many of which were acknowledged during this presentation. And then finally, here's some resources. Some of these resources are state specific, DOD specific, branch specific, and then there's some resources for some of the information we shared during this presentation. But we truly like to appreciate all of you for spending some time with us today to learn more about mandatory reporting as it relates to both civilian reporters and military-based reporters. And we thank you so much for your time and attention.